Hey guys, it's HINA Chef here at Rebalance Physical Therapy in Center City, Philadelphia, and Narberth, Pennsylvania, which is on the main line. Today I want to talk to you guys who may have had symptoms of constipation after having a C-section, and what that could be and why that might be happening and what can be done about it. So obviously constipation can be a very uncomfortable thing, especially after you've had a baby and you're trying to get your body back and you don't really understand why this new symptom has started when you've had perfectly fine bowel movements in the past. Now, a couple of different reasons why that could be happening. Now, one, if there's any sort of hormonal changes, obviously that's going to play a potential effect in how your body is generally functioning. So if you feel any other symptoms that might be going on, it could be a hormonal imbalance. Usually, progesterone and estrogen levels that are in imbalance usually can sometimes contribute to that. Number two, it could be dietary changes. So if you've had to modify your diet because of the needs of your child or for milk production, that can definitely change your stool and the way it's moving. Generally, you want to make sure that you are, making sure you're getting enough fiber into your diet, both a soluble fiber as well as an insoluble fiber. And we have, other videos that explain what that is, but you kind of want a combination of both. Because fiber actually, between bulking up the stool and helping it actually push along, that will continue the peristalsis, which is basically the movement in the intestines of moving basically your bowels through your system. Now, the third reason, which we see quite a bit of at our clinic, is constipation due to any type of abdominal surgery, and for today, especially C-section. And I want to explain to you why that could be happening and what could be going on. So basically, anytime you have any type of a surgery, you're creating scar tissue in that area. So specifically for the abdomen, if we look at this photo right here, if you've had a C-section, you're basically having, a pretty low cut into the abdominal fascia, and then you got to go in and, your gynecologist goes in and takes the baby out of the uterus, which again, right here, this is more, right in back of the bladder here. But you can see that sometimes if there is any type of a C-section scar here, you can form scar tissue, and that's not that far away from the intestines, which is right here. Now, sometimes you may have other restrictions in these tissues for different reasons in the past, but then you have a C-section and that just disturbs the environment. And so now what ends up happening is you might have some scarring or restrictions in and around other tissue that's in this area that's not shown necessarily in here, but you can see these white this white coloring right here basically shows any type of scarring that can happen in between bowels and in and along the bladder, as well as maybe on the sides. And this can actually disturb the environment of the GI tract and the intestines, as well as other organs such as the bladder as well. And so when these organs can't move around the normal way that they should be, then they're not going to function as well. And so improving the scar tissue and improving the mobility around this area, potentially due to a scar, can definitely help kind of jumpstart the GI tract to start functioning right. Now, the other thing that can happen, because this is just one part of it, is that, bowel has to basically move through the small intestines as well as the large intestines. But the other thing that governs how stool is basically let out is at the end of this tract, you have something called your pelvic floor muscles. And the pelvic floor muscles, as you guys may know in some of my other videos, is this group of muscles down at the bottom of the pelvis, okay? So this is if you cut the body in half, especially at the pelvic level, and you're looking down and you've taken out all the organs. You have this group of muscles, which is called your pelvic floor. Now, once the bowel goes through the intestinal tract, it ends up in the rectum. And then it's kind of stays stored in the rectum until your body basically signals these muscles here to relax and let the stool out. Now, what ends up happening for some people is that during pregnancy, or maybe they've had some constipation issues in the past, but maybe pregnancy has stirred things up, these muscles of the pelvic floor, okay, also known as the muscles that many of you know as the Kegel muscles, these are the muscles that actually need to relax in order to let stool out. And if these muscles aren't relaxed, then the stool can't come out. What ends up happening is, again, if you imagine that this is, or not imagine, this is the rectal opening, if these muscles are really tight, then that hole is going to become smaller and it's not going to let the stool out. So sometimes these muscles have to actually be retrained and worked on to allow these muscles to relax and allow the stool to come out. So sometimes, again, in summary, constipation after a C-section can be due to, dietary changes. Also, I forgot to mention, but water intake. So you want to also drink plenty of water to make sure that your body has the hydration it needs to push the stool along. So between diet changes, that includes fiber, water intake, making sure your hormonal levels are as much in balance as they can be, which you would want to specifically talk to your doctor about. And then making sure that the scar and any of the tissue around the organs known as the fascia, the flexibility of that is improved. And then making sure your pelvic floor muscles are actually relaxing in the correct way when you do have a bowel movement. Now, who do you go to improve the scar tissue and to retrain the pelvic floor? Well, you need to see a specialized physical therapist that knows how to treat the pelvic floor musculature and really understands how that functions in conjunction with the rest of the body, because the pelvic floor muscles don't just work by themselves. They actually work with abdominal muscles, they work with low back muscles, they work with your diaphragm, which is actually a muscle that's located underneath your rib cage that helps you to breathe. And a pelvic floor therapist can really help you kind of coordinate those functions together so that when you're having a bowel movements, these muscles are doing the right thing. But not only that, someone who's actually highly skilled can also do a certain type of therapy called visceral mobilization, and scar tissue mobilization that can actually improve the flexibility of the scar and the fascia in and around the organs, and freeing all that up just makes a bowel and intestine and bladder and all kind of stuff, it makes it really happy. So, when the organs are happy, then they function better. So if you are having any of these symptoms, which I'm imagining if you're watching me right now, that you probably are dealing with some sort of constipation issue, then it's a no-brainer. If you live in and around Philadelphia or anywhere close to us near the main line, then no-brainer, come in and see us. We deal with this stuff every single day, and we have really good success treating this for most of our postpartum and peripartum moms. And then if you don't live in and around in this area, then shoot us an email on our website. We are rebalancept.com. That's REBALANCEPT.com. We have lots of other helpful YouTube videos and information that might be able to help you, or you can just send us a quick email and we can try and help you find someone in your area. So I hope this was super helpful for some of you guys. I hope you have a wonderful day. Thanks. Take care.